December 3rd, 2021 is the International Day of Persons with Disabilities. This day was declared in 1992 by the United Nations and is an opportunity to increase awareness of the challenges faced by individuals with disabilities worldwide. In this Trauma and Mental Health Report video, we focus on invisible disabilities. Due to their hidden nature, invisible disabilities are often shrouded in misinformation and stigma. What is an invisible disability? An invisible disability, as defined by the Invisible Disability Project, refers to a physical, mental, or emotional impairment that goes largely unnoticed. This can include chronic pain, gastrointestinal disorders, brain injuries, the autism spectrum, mental illnesses, and more. It's important to note that the experience of someone with invisible disability is unique and is subject to change, alongside changes in the body and mind. A person with a visible disability will typically show some physical indication of their condition, such as a support animal or a wheelchair. While having overt signs of disability can result in differential treatment, there is typically no disputing the disability due to its visibility, and the need to provide accommodations is clear. This leads to improved accommodations such as accessibility ramps. There is also legal protection for those with visible disabilities, such as the Ontario Human Rights Code. A person with an invisible disability, on the other hand, may struggle with real physical or mental pain, which may not be visible. However, this does not mean it's not real. These individuals can face many challenges, as well as find additional barriers accessing accommodation, treatment, and support. There remains a deeply rooted stigma associated with having a disability, which is especially true for individuals experiencing mental health conditions. Some may make the choice to hide their disability to avoid being seen in a negative light, such as being perceived as someone who is taking advantage of the system. Disclosing an invisible disability is seen as risky in a school or work environment, since a person may face prejudice, disbelief, or negative evaluations from others. Without knowing that there is an underlying disability, employers, teachers, coworkers, or peers may make value judgments about the person's character, attitude, or capabilities. This in turn affects the person's professional or academic endeavors. It may also affect one's personal and intimate relationships with family and friends. This predicament of disclosure, where an individual must weigh risk against potential benefit, results in people choosing to hide their condition, which can then lead to feelings of shame and inadequacy, and a fear of discovery. Whether for work or school, many must overcome hurdles of bureaucracy in order to receive the accommodations they need, such as filling out complicated paperwork and registering with disability services. Therefore, invisible disability tends to remain an individual burden. People with invisible disabilities may face additional difficulty in receiving a diagnosis for their condition. It may require several visits to healthcare practitioners and various testing before a diagnosis is made. Continuous disregard of the condition can negatively affect the ability and desire to cope. It's important to shed light on this issue because awareness is the first step toward acceptance. If you or someone you know is struggling with an invisible disability, it's important to know first and foremost that it's okay to ask for support. Supporting loved ones is crucial in the process of understanding the challenges they face and choosing the best path forward. Here are some tips on how to support yourself or a loved one. Give space. Be with them when they need, and step back when they need as well. Learn more about their disability. Knowledge about the challenges specific to their disability will help you empathize with them. Ask how their disability affects them, how you can support, and if so, what support would be best for them. Whether at your school or workplace, know that you can request the accommodations you need. Seek professional support and further opinions when needed. There may be treatments, resources, or support tools available that help reduce the stress of living with an invisible disability. Continue to advocate for yourself. creating safe spaces is a step towards eliminating stigma. Thank you for watching this Trauma and Mental Health Report video. For more information and to find the resources used in the making of this video, please take a look at the links in the description.